Welcome to Feel Good Naked. I'm so excited to have you on the show. I feel like the area you focus on, Marie, is really important, but it's something that a lot of us don't know about. So if you can kind of tell us, what do you work in? Like, what's your focus? What is the area within that you really feel passionate about for empowering people?
Hi, everyone. Well, my name's Dr. Marie Fernandez. I'm a physical therapist, but I actually specialize in pelvic health along with orthopedics. When it comes to pelvic floor or physical therapy or things like pain, unfortunately, it brings up very vulnerable conversations and different types of empowerment when it comes to the body.
I love what you do because I think most people listening, they'll be familiar with physical therapy. They'll know a little bit about it, but maybe not so much in the area that you specialize. And especially those in the audience, like we were saying before I hit record, that have never, maybe they haven't had kids or they haven't experienced some of the things and issues that can pop up after that, but they're experiencing other things. So the biggest question to ask you is, what are a few of the different issues that the clients you work with have? What are some of the symptoms they're experiencing, some of the trauma that might have induced that or caused it?
Mhm. Yeah, so for me personally, if we talk about orthopedics under an umbrella, I treat a lot of patients who are experiencing pain, chronic pain, trauma, injury, but specifically into pelvic floor. I love what you said that it's so much more than just pregnancy. Everyone needs pelvic floor PT, especially my women out there. You don't necessarily need to experience having a baby to appreciate pelvic floor PT. There's a lot of patients that I see who have pain with intercourse, incontinence. It's actually a lot more common than we think, but it shouldn't be normal. So, a lot of patients that I see undergo symptoms with pain in that region, difficulty with using the bathroom, pain during penetration.
What are some of the things that cause this? And I know every person will be different, of course. It's not one thing leads to the next, but just so people get an idea of maybe this is why this happened. And we obviously caution you should go and get a consultation to know, but just generally, what are some of the things that might have caused the incontinence or might have caused the painfulness during intercourse? Like, what are some of the things that come up?
It depends. Because, like you said, we all have our own histories, our own experiences, our own traumas. Sometimes even aging is a factor. There's also hormonal factors that come in. There's a lot of different factors with the human experience. And when it comes to things like trauma, there's unfortunately a lot of patients that I see that have experienced sexual abuse. And that's another thing that comes up. As a physical therapist, I'm a movement specialist. However, when you think of the body, it's so much more than muscles, nerves, and bones. There's a brain that's involved.
This is such a key point. I love that you say it as someone who's a movement specialist because you would expect someone who is, for example, a therapist to say this, but you wouldn't necessarily expect it in the more physical sciences. But I feel like that's really important to touch on. And I'm going to ask you a little bit about that because you mentioned the mind body disconnection. So some things maybe not quite working because of that. But also there's the case of you are possibly creating some of the issues or making them worse because of things that have happened, right? That you mentally feel and they go in somatically. So I'm curious if you can talk a little bit about that. Like if there's been an example in general terms of something where it's this mind body issue popping up and it's causing pain or embarrassment or issues that someone didn't expect.
So when we think about the human experience, especially at least in our culture today, you're so on all the time. There's always some sort of pressure, there's always some sort of demand to be your best. And when it comes to everyday activities, oftentimes we just go, 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 go. And we don't realize how much demands that has on our body. So, for example, how many hours on your phone? How many hours on the computer? Cavemen, for example, they didn't spend this time sitting. They were hunting, going out and about. There's a lot of things that we do normally that don't really honor our body. Over time, it can bring about different stress, types of trauma.
It's the movement patterns, it's not dealing with the stress, like, we lock all this tension in our body, or we misuse muscles in certain ways, we ignore different pains, we don't resolve some of the underlying stuff that can really sit in the body, and it can manifest in these ways. Pain is, it's the worst thing that you can live with. It's horrible, physical pain especially, but, I mean, when it's accompanied with mental pain or issues, it's just debilitating, and a lot of times we don't do anything about it until it gets to that
Mhm.
point. So I'm wondering actually if you could talk a little bit about what are some more, like, minor issues that people might be facing related to what you do that they don't immediately come to someone like you, but it builds up?
I love how you say that too, because oftentimes people don't come to a physical therapist until they're experiencing something like pain or big underlying symptoms. So, especially thinking about my position in healthcare, when I was working in a traditional environment, unfortunately, it would take maybe 3 to 4 months till they finally see me. And in that context, when I was in a traditional environment, I would think like, wow, you've been experiencing this pain for 3, 4 months without being able to see a provider. But now I work in a different model where thankfully I'm able to see my patients right away through direct access and without having to worry about insurance making things overly complicated. With what I've noticed with a lot of patients, oftentimes we kind of ignore these signals. Think like, "Oh, my back hurts. Oh, I'm just gonna ignore it."
I've done this too, like, I have completely been that person, even in the fitness space, who waited to do it, and that's why I just wanna talk about it because I think there are these warning signals we see, and I wanna give you a specific example and see what you think. So let's say I'm struggling a little bit with my bladder. I'm peeing a lot, or maybe I'm struggling, it's not comfortable. Like, what are some of the really big red flags there that say, "Okay, it's time to go to a physio"?
May I kind of alter your example to something
Yeah,
that I
change
see
my
fairly
scenario.
regularly?
Yeah.
Yes. So if we're talking specific into pelvic health, what I've noticed is a lot of people tell the truth through joking or satire, because unfortunately, with pelvic health, I feel like a sense of shame or vulnerability when it comes to talking about certain symptoms. So, for example, there are so many like badass women, badass people who are very athletic, engaged in sports. For lifting, oftentimes, like let's say you're coming in for like a deadlift or you're into CrossFit or you're into powerlifting. A lot of people experience leakage when it comes to heavy lifting, like urinary incontinence. There's so many jokes that like, "Oh, I just peed myself," or like, "Oh, I can't lift too heavy because this just happened." There's a certain element of comedy when it comes to feeling comfortable talking about the body sometime. For me as a physical therapist, I like to create a safe environment and really talk about different things that people experience, whether it be leakage, urgency, pain, and to kind of get down to the root cause of it. Sometimes it's a mixture of different systems in the body. But specific to things like incontinence, what I do is do my own assessment, see how the muscles in the pelvic floor are working. More importantly, how they're coordinating and how we could use the mind to body connection to get through your goals, whether it be lifting heavy or being able to pick up your kids without any leakage or being able to laugh without having to worry about peeing yourself. It's a very unique field.
Wait, I think it's really good that you mentioned this because a lot of times we laugh off and we normalize what is not normal to experience because we don't realize it. And I remember when you're telling this, scenario of thinking back, I remember we had a trampoline when I was a kid and my mom would be jumping on it and she peed herself. And this was
Mhm.
after having kids. My youngest sister was like 9 at the time. So 9 years since giving birth, and that was still an issue. And we were laughing about it, but I'm thinking, like, even now, like, wow, that must not have been comfortable to experience that, to think that that's just what you have to deal with and to not do anything about it. And so that's why I just want anyone listening, even if they're not experiencing this, if you have a family member, especially who is, so that they know they don't have to keep doing it, even if they gave birth years ago, or even if they're, much older. This doesn't have to be normal, right?
It's so mind blowing how common things like this are. I love helping women. And I feel like pregnancy is one of the most underlooked human experiences out there. You have 9 months of this tiny human growing, and there's this expectation of, okay, you're just going to pop out the baby, and there you go. Here's a human. And it definitely is a blessing to have a healthy baby, but oftentimes I feel like the experience of the mother is so overlooked. How common it is to tear, how many hours in labor. And when you talk about it with other people, oftentimes it's like, ah, that's normal, or you should have seen when I had my baby. Yeah.
Outdoing each other with pain and complications.
Yes, yes.
Well, my tear was this big and I was peeing myself for years. Like, that's something
Mhm.
you want to claim. That's not like you're not out painting someone. But I think
No.
that's really it's important that we talk about this because for those who are mothers and those who think about it, having kids, just to know because I remember being shocked when my friends started having kids and hearing some of the stories of the tears, of having to wear, essentially a diaper for a year because of the fluids and not focusing on pelvic health. I don't think they even realized that that was an option, that you could go to
Mhm.
someone that could help you through it. So I want to ask you, what is the healthy way when we're thinking about pelvic floor day to day, how it works, how we feel, like what should it feel like generally? If we're super healthy and we've done the exercises and we're in a good space, what should that be like? For example, a healthy amount of time that you're peeing, or and I know it's gonna vary by body, of course, or what it should feel like when you're having sex. All this stuff that we're doing on a day-to-day basis or weekly basis, however frequently you're doing it, how should that feel if you didn't have the pain or if things were functioning optimally?
There's this book that I really like. It's called The Body Keeps the Score. And essentially, the big point of the book is we all have our own experiences, we all have our own traumas, and our body is the first thing that holds on to those traumas and those experiences.
Thank you for recommending that book because I think that I always ask for guests if there are resources that you've used or you recommend. That's a huge thing already. So thank you for that. It's your health is holistic. We're talking about one area, but really none of it is disconnected. A better way maybe for me to ask you this would be, let's say someone comes to you and they are healing after having a child and they're experiencing incontinence, they're experiencing discomfort, generally any type of thing like that comes after having kids often. What is kind of the ideal place you want to get them to after physical therapy?
So, for me as a physical therapist, oftentimes in the first visit, we talk about different goals we want to accomplish. Oftentimes, it's not having any pain. Oftentimes, it's also not experiencing leakage. But goals that I like to highlight are very functional and meaningful. For example, some people want to do functional activities like being able to hold their kid without leakage. There are more high level activities too, like wanting to be able to hit better PRs at the gym without experiencing any pain or leakage.
So much of what you do when you're trying to help people to heal essentially is not so much about getting to this amazing place as it is to removing the pain and the discomfort that stop you from enjoying your life. If there's something you know in your body that is stopping you from just having a normal moment without thinking about it, that's something to consider getting treatment for. It's not something that you need to live with. And I think a lot of times that we do because we just justify it as it's not that big of an issue, right? It's not that big of a
Yeah.
problem.
Exactly. I see a wide spectrum of patients, not only with pelvic health, but with orthopedics too. And there's some people that I see that have difficulty getting out of bed in the morning or difficulty walking. I'm sure the majority of listeners here, we take those activities for granted. But with my perspective as a physical therapist, that's something I see so regularly. There's so many people that I see that unfortunately have dyspareunia. So they have pain during sex, but they can't feel like they talk about it. I honestly feel like with some of my patients, we have good conversation where we undo years of trauma. And this one patient in particular, when I first saw her, she told me, "I saw a gynecologist about 30 years ago, and they told me my vagina was depressed. And since then, I've had this sense of hopelessness, like I can't do anything." And when she talked about her symptoms, like leakage or pain with her partner, initially she would tell me with a sense of shame. It was a light bulb moment being able to open up to me. Yeah, thinking about all these stories, there's so many people where they share like, "Oh, it's been months, it's been years since I've been able to be intimate with my partner because it hurts." But also a lot of my patients share this sort of guilt that they have. And when we're able to do things like foster a safe space and do physical therapy together and do my assessments and treat them with pelvic floor physical therapy, pretty much all of my patients after a session, especially the first session, they say, "Wow, I even feel taller. I even feel like I'm finally breathing. Is this what normal feels like?"
There is something so
Yeah.
powerful. I mean, first, thank you for sharing that story because I think that's a lot more common than people will admit to. And it feels like no one else is experiencing that, so you don't want to communicate it, you don't wanna say anything. But I know for a totally different issue, like, I've been struggling with my voice, right? And when I first went to speech therapist and they said to me, "Let's talk about why it's happening," I left there feeling less tension in my throat, and all that person
Mhm.
did was give me space to speak and assure me that we could work through it. And that is incredible when you think about how powerful your mind is, that if you just get that space to open up and let that shame go and express, that you already experience an increase in your quality of life.
I also wanted to say when we first got onto the platform together, your voice sounds so much better. I was listening to that podcast recently when you were opening up about your experience, and my heart goes out to you. And it reminds me of a lot of my own experiences and a lot of my experiences that my patients have had too. Like when you're able to have a safe space to speak, especially along the lines of health, that's where true empowerment lies, being able to speak your truth, whether it be literally or also in the context of physical therapy too. Like when you're able to feel safe to be vulnerable and say your experiences.
The whole therapeutic work and with the body is so related, whether it's your throat or your pelvic floor. There's so much similarity across where this trauma originates, what the problems are. And I think what's really good is what you said. You're someone who's listening, but also you're objective because it's hard to tell your friends or your family members that you're struggling with peeing. You're struggling with going to the bathroom. You're struggling with sex. Like, it's not something you can always talk about to someone who knows you well. And when you can say that to someone who's objective but also qualified, I think that it really does change everything. And I'm emphasizing this because I want anyone experiencing this to feel like, let me go and do this. Like, let me just
Mhm,
try. Let me just go in
mhm.
for one session and see because it really does change everything when you do.
And in the perspective of a physical therapist, it's a very different level of empowerment and trust and vulnerability when you're able to build that relationship with your healthcare provider. With my training, I use those objective assessments and my findings to tell them, like, hey, this is what's going on. This is what I see. But more importantly, this is how we fix it. When we talk to people like our family, our friends, they're seeing on the perspective of, "Oh, my friend is experiencing this. Let me," oftentimes, give unsolicited advice. And, with that advice, it's coming from a good place, but not necessarily trying to solve or empower them with their experiences. Oftentimes it's, "Oh, it's normal, that happened to me too."
And it goes back to what we were saying of the outdoing each other. "Oh, you think you're feeling this, I had this. I got over it. It's okay, you will too." And it's not helpful, like you said, towards resolving the problem. And I think
Mhm.
actually what we should really speak about, because I wanna make sure I ask you this because it's so important, is you mentioned how important it is for preventative care, preventatively for pelvic floor health. Is there anything that you would say to everyone, "You gotta do this. This will make such a difference in your life. This will help with this later on."
I think the easiest thing to start off with is go to your doctor's visits. Like, see not only your primary care provider, but advocate to see your OBGYN. If they offer things like tests, your regular scheduled tests like pap smears. Another thing too is don't ignore the pain signals or be mindful of your body. So for example, if you experience something like leakage, I hope listening to this podcast helps you realize, oh, that isn't normal. I should talk to somebody, whether it be a pelvic floor physical therapist or your OB. Another thing, I host things like movement screenings. So for me and my patients or people within the community, I love to see them and see how everything's moving, listen to different concerns that they have and lead them in the right direction or begin with pelvic floor physical therapy.
The screening is a good one because that's a really simple way to just figure out if something's not quite working or could be indicative of a future issue or problem. And it doesn't take that much time for you to do. And it's a
Mhm.
small thing that it does make a real big difference. But is there nothing that you would say you should be doing this regularly for most people?
That is such like a different can of worms because when I hear things like, oh, you need to do your Kegels regularly,
Yeah.
pelvic floor PT is so much more than Kegels. There's a lot of patients that I see where sometimes they're overly Kegeling, with the magic of Google, you see a pelvic floor. Probably the first hit would be Kegels. Oftentimes, it's more than just Kegels because some people, their muscles are overly activated in their pelvic floor. So, sometimes Kegels are a great tool, but what's more important is being aware on how to activate and turn off your pelvic floor. So if I was to say like, "Oh, this is the one thing you need to do," I wouldn't necessarily say Kegels. Perhaps maybe even like yoga instructors are very well versed on this, but practice diaphragmatic breathing. I have a bias because before I was a physical therapist, I was a yoga instructor, and I personally love to integrate yoga with treatment for my patients. We can even practice this together just to get a good visual.
Let's
Because
do it.
wonderful. Because the way that I like to do diaphragmatic breathing is not only with the diaphragm, but also engaging your pelvic floor. So before we get into that exercise, I want to speak a little bit more about the core. Your core is like a capsule. So it's more than your six pack in the front, but we also have your muscles in the back, the diaphragm on the top, and the pelvic floor on the bottom. So you want to think about this capsule working together on all four sides. So to begin, wherever you are, whether you be sitting in front of a desk, in a computer, or if you're driving, you can keep your eyes open, be safe and mindful, but let's place both of our feet on the floor. Feel grounded, finding that connection. Good from here, sitting up nice and tall, pretending like there's a string on your head. We're slowly lifting you up. From here, you can just wiggle around a little bit, get comfortable in your space. And if you are safe to, I invite you to close your eyes as well. Good. From here, just noticing where your sit bones are, where your feet are, and where the crown of your head is. Good. From here, let's just take a deep sigh together and slowly melting to your seat. Good. Let's place hand on your diaphragm and maybe one on your heart. Good. From here, feel the connection in your diaphragm in your hand. Maybe slowly rising. Good. And now let's bring our attention to your pelvic floor, feeling where your sit bones are in your seat and acknowledging the area between, surrounding, and into the pelvis. Good. From here, imagine your pelvic floor like elevator doors closing. Inhale, elevators coming up. Good. Exhale, slowly coming down. Elevator doors open. Good. As if you're about to kegel, elevators close. Slowly bring your breath up into your hands. Pause. Elevator comes down. Doors to open. Good. From here, slowly blink open your eyes, maybe wiggle around a little bit. Just notice where you are. So that's kind of like a very short version of how I would do that exercise. But a big component of your pelvic floor is just having that awareness. How are you feeling when I was talking through that exercise?
I think it's good bringing the awareness to the different parts of the body. And this is something I'm supposed to do as well for vocal health. So there's many benefits to this kind of breathing beyond just what we're talking about. How would you suggest to integrate that into your day to day to make sure that you are practicing diaphragmatic breathing semi regularly? What is something you would say
Mhm.
to clients to help them to do it?
I really like to do tactile cueing. So, what I would recommend with some of my patients is to take a towel, roll it up, a little hand towel perhaps, so it's just like a little cushion. And then to bring your awareness to the pelvic floor, what I would do is recommend sitting in between it. So, for example, with that exercise that I did, you'd have the towel between your sit bones. And then it's easier to bring your awareness to the pelvic floor. You could think about simple cues. With the short version that I just did now, we went a little bit more into visualization and kind of just speaking into where the muscles are. But I think if you wanted to practice more of that awareness, it'd be good to take that towel and do a couple breathing exercises with that.
I was asking how to integrate it in your routine, but you actually gave us a really great way of how to do it without guidance, without having someone guide you through, which I think is important to know. And then I'm guessing if you want to make it part of your routine, then you can just do it something like end of the day, after working, I don't know, at the desk, like in the morning, just simple ways because it's hard to remember all these habits that we're supposed.
I like how you call it a habit because the
Yeah.
key thing to do something consistently is making a habit. So, for my patients and in my own practice, well, first we have the morning people and the not so morning people. I am a not so morning person, but if you're a morning person, I would recommend doing it in the morning when you first wake or in the night before you go to sleep. Or you can do and, depending where you are with your practice and how often you'd like to. So, for those that like to do it in the morning, I would recommend before you get up out of bed, you can just have the towel ready and start that technique. Do some rounds of diaphragmatic breathing. You can do different types of breathing, like the box breath, where you inhale for about 4 seconds, hold for 4 seconds, exhale 4 seconds, and hold for 4 seconds. You can do that, or right before you go to sleep. I think it's a really good way to wind down. Personally, I like to do more of ratio breathing if we're getting ready to go to sleep. We prolong our exhales instead. So, for example, if we were doing that same 4 interval count, we would inhale for 4, but exhale for 8 while bringing our awareness to the towel or the pelvic floor. If you have access to a Swiss ball, like those big bouncy balls, that's another good one to do. If you wanted to just bring more attention to your pelvic floor, there's certain yoga exercises that are very valuable, like cat cow is one to bring your attention to your pelvic floor. Or I like to do child's pose rock backs, but instead of having your knees out, And feet in, try the variation where you're bringing your knees together and feet
Mhm.
out. Happy baby is very good for your pelvic floor if you wanted to do something against gravity that might be more comfortable.
I love that you've got the yoga background too, because that adds a whole nother level of holistic wellness to it, which is really important in the sense of body integrity and anatomy. Last big question: where can people connect with you? How can they find you? And what are the ways that you work with them?
So, one of the easiest ways to find me is on Instagram and TikTok. My username is at Marie's Movement. You can also go onto my website too, movementpt.com. P as in physical, T as in therapy. Most of my treatments are in person. So if you're in Orange County, especially in Fullerton, California, but I do online as well. If you wanted to do physical therapy, I could only treat within the state of California. However, I could do more wellness oriented practices if you would prefer internationally.
Thank you so much for sharing all of this. I will include links to connect with you.
Thank you so much for having me. It's a different perspective of feeling good naked.